Dear Grace Marie Bricali, President of the ME Alliance, colleagues and friends, as you come together for the International ME Research Conference Week 2026, I want to start by acknowledging why this work matters. Behind every dataset, every discussion, every clinical insight, there are people living with myalgic encephalomyelitis, ME, whose lives have been profoundly changed by this illness. It's a privilege to join you and to recognize 20 years of invest in ME research. For 2 decades, this charity has kept ME research moving forward, funding science, bringing experts together, and refusing to let this disease remain overlooked. This conference week exists because of that determination. Over those same years, people with ME have sadly had to endure far too much disbelief and delay. Many were healthy and active before they became ill. Today, many live with severe limitations, not only to their health, but in their education, their work and their independence. That reality should concern all of us. ME is a serious, complex, multi-system physical illness. WHO classifies it as a neurological disease, and it is important that we use this classification so the true scale and impact of ME can be better understood in health data. People affected deserve to be believed, to receive an accurate diagnosis, and as we wait for research to find cures, to have access to appropriate care, as well as support for their daily needs. So much about this debilitating disease remains unknown. Progress depends on research, on clinicians and scientists working together, sharing evidence and asking difficult questions. The collaboration you see here between Invest in ME Research, the European ME Research Group, patient organizations and the research community is exactly what is needed. The second WHO European Programme of Work, our Health Compass for the next 5 years, seeks to make sure that no one is left behind, especially people in vulnerable situations, including those with disabling condition. It calls on countries to strengthen diagnosis, care and rehabilitation for people with ME and make sure these services are part of primary healthcare and universal health coverage. This conference is part of that valuable work to bring new understanding, effective treatments and improve the lives of people living with ME. A person living with ME once said, quote, "Hope is not a cure, but it is what keeps us holding on until one is found," unquote. Let us make sure that hope is matched by action and that the next generation looks back on this moment as the time when progress truly accelerated. For every person living with ME, we owe nothing less.